Whitney Swander and Gabby Knighton from the City of Baltimore. Whitney is the Continuum of Care Coordinator for the Mayor's Office of Human Services for the City of Baltimore. She's responsible for leading the agency's compliance with the Hearth Act, and she's helped develop and implement the city's coordinated assessment and access system. So we're going to hear from her, and then Gabby Knighton is the outreach coordinator for the Homeless Services Program in Baltimore in the Mayor's Office. She oversees the city's homeless voucher program. She facilitates the coalition of outreach teams. She coordinated the 2013 point-in-time count and registry. We in New York love our street count, so we know how much work that is and how important it is, so that's a great job. And she also coordinates the Baltimore's Project Homeless Connect. They've actually taken a tool like this and they've tried to actually make it work in Baltimore. And so we're going to get to hear from them about how they've done it, what they've changed, what they've learned.
We're going to try presenting from here to avoid the mic issues. So I don't feel as dynamic here, so bear with me. I'm not used to this sort of setting. So actually listening to Jessica kind of give the intro about why a coordinated assessment and housing placement system reminded me about why Baltimore went down this road of creating our own assessment tool, and part of that goes back to the Hearth Assessment or the Hearth Act, and I distinctly remember being in a Hearth implementation clinic with the National Alliance to End Homelessness, and they had all of this data where they were comparing Baltimore across communities across the country and demonstrating that really we weren't experiencing anything unique, but Baltimore tends to think that things are really unique. And so having a process, a local process that built some additional buy-in around this coordinated assessment process and making it a tool that was specific and responsive to what we see in our homeless populations and subpopulations, and being responsive to that was a really important process for our community. So Gabby and I are going to kind of walk you through what our local process was for taking the VI-SPDAT and creating what we can term a community-endorsed coordinated assessment tool. So some background for our process. In about 2011, I brought together a work group. It was really a coalition of the willing. It was when it was an idea. Wouldn't it be, I basically brought this group together and said, wouldn't it be great if we had a coordinated process by which individuals and families accessed housing and services so that we didn't have that triangular maze that people were trying to navigate by themselves, and instead we could create this very clear pathway from crisis to housing, crisis to home. And this coalition formed. They were really excited, and we really tasked them with looking at the models that were currently being utilized across the country, looking at best practices, and then trying to develop a plan and recommendations about how locally we could move towards a more coordinated process. Another part of this was it was before there were any regulatory changes or requirements for coordinated assessment, so we were looking kind of at the strengths in Baltimore and what we could utilize to launch a coordinated system, already recognizing that we had community action partnership centers that were kind of hubs for families or individuals that were at crisis, or our family investment program, different things like that. So we kind of got a big picture of what we could do with coordinated assessment, and we dreamt really big. We thought through this process we were going to move everyone through all of the social services that they needed through this direct process. And that kind of brought us to needing a really comprehensive assessment. So we started to arm kind of a plan for implementation and looking at what was the most important. Our current state in Baltimore, which is probably important to lay some context for this, is we have really no coordination of services from our shelters to our permanent supportive housing. How people get into these different housing interventions really depends on if they make it to the right front door, if they get the right case management who's able to navigate or advocate for them or has that big binder that has all of the resources and they're able to get connected with housing and services. And so it really allowed us to put together a core competency that led to what we wanted to see in a tool. We wanted to close the side doors. We wanted to create a process by which people were prioritized by their need, by their acuity, by their housing history. And so we needed a tool that would do that. We needed that multifaceted BDAT that would look not just at, and we call it the BDAT, the Baltimore Decision Assistance Tool. instead of the VI-SPDAT. But we needed that tool that would be able to triage people in all of our services, starting with prevention and diversion and ending with our most service-intensive interventions like permanent supportive housing. So right now we are in our implementation phase, and we're actually kind of switching what we expected. We expected to dial on and coordinate, starting with our shelter placements and our transitional housing placements, and then move up into our permanent supportive housing. And that really had to do with the people that we had at the table, who a lot of our permanent supportive housing providers were kind of giving us this and saying, this is great, not for me, I'm not ready. And we didn't necessarily have a strong tool that would make it possible. And so the PMCP has helped us see how we can move towards permanent placements quickly. And so we're one of the 25 cities through the 25 Cities Initiative. And like I said, we're flipping that, and we're moving and looking at accelerating the pace at which people access permanent supportive housing to be able to facilitate quicker movement through our temporary housing. So first 100 days, permanent supportive housing placements, and then starting day 101, September 1st, we're committing to coordinating the rest of our system. So that's kind of some background for how we went about our tool development. So there was a shift sometime probably about September of last year where we went to our work group and we really empowered them to move from being recommenders or advisors to being decision makers, and saying that they were going to be the group that was responsible for implementation. And so one of the key steps that we needed to, one of the key hurdles we needed to address was this assessment tool. HUD had said, you need to have a comprehensive assessment tool. That was it. So working with CSH, who's providing us TA in this area through the Priority Communities Initiative, we kind of took, this was a daunting process. We didn't know how you wrote a tool. We had no idea. And the process of thinking about like how we would put that together was just terrible, to be honest. So Colleen Velez helped us collect what she thought were kind of the most effective tools around the country. And we had the benefit of having a few agencies that worked as kind of de facto coordinated assessment sites, or just assessment sites, who were really good at making referrals, and because of their history in the community were able to get individuals or families quickly into temporary housing. So we took those tools to them and we asked them to test them. And part of this was changing what they were doing. They were moving from doing full psychosocial assessments with people to moving just towards housing barrier assessment, seeing what did people need? What was the next step that they needed to return to a stable housing environment? And so part of this was learning with these providers, like, how do you move from that? And what are the important questions? And so we relied a lot on kind of what the tool scoring said and what their gut as professional assessors, and having done this for 5, 10, 15, 20 years, told them about what was an effective tool. So then about the same time, the VI-SPDAT came out with the endorsement of Community Solutions. And we felt as a community, because of the weight of the 100,000 Homes campaign and Community Solutions behind it, we really needed to take a good look at this tool and see if it worked. So we did the same sort of thing, but we expanded. We sent it to our assessment sites and had them test the tool. We sent it with our outreach teams and had them test the tool. And we sent it to all of the agencies that are part of our coordinated assessment working group to test it and see how it did with what its strengths were and what its limitations were in assessing the clients that they saw in their programs. And overwhelmingly, we got a response that it wasn't the right tool for us. So we went through Gabby led the process, went through a very detailed process of collecting question level feedback for each question, so that if it was a content piece that people had an issue with, if it was a language piece that people and providers had an issue with, we were going through and collecting that question level feedback, compiling that, and then taking it back to a work group. We had about a 5-hour work session in which we went question by question and really hashed out what we wanted that question to ask, what we were looking for, and how was the best way for us to collect that information. And through this process, it really helped us define kind of what the role during this process between like what the role of the assessor was and what the role of the navigator was. Because, there is that piece of doing a housing barrier assessment is not getting people ready for housing necessarily, or getting them to that point that they're ready to lease up and move into a unit. So it helped us kind of have those conversations about what else needed to be added into our coordinated assessment process, and we couldn't just expect our clients to go from assessment one day and show up the day that their housing unit was available for them. So it helped us look at those pieces. So through this process, these are kind of what we saw coming out as the really clear purpose of our tool. We needed to have a comprehensive tool for a comprehensive process, and that's something that our tool hews very closely to the VI-SPDAT, but it's also very dynamic. So we knew that there were a lot of people that we were going to touch through our system who didn't necessarily need a full housing barrier assessment or a full psychosocial assessment, and we just needed to get the right information. So we needed to create a tool that was responsive to what people were telling us. So it's a dynamic assessment that starts with a pre-screen. It asks questions that kind of trigger us to understand a bit more about the client's housing history and their current needs. And we just kind of parse out that information so that we're able to stop when it makes sense and meet people's needs there, as opposed to taking them through a very long and detailed process that is quite invasive. We also wanted to triage for a number of factors that aren't necessarily tied to medical vulnerability, because we saw in our population families and individuals that were chronically homeless but didn't necessarily match up with the risk factors that would give them a high VI score, for example, but which we knew without a permanent supportive housing intervention or other type of intervention, they might continue to be chronically homeless, and so we wanted to be able to parse those details out. And I think I'll turn it over to you.
So the key differences that came out of our conversations on making local adjustments to the VI-SPDAT, one that Whitney just mentioned is that our assessment is a little bit more comprehensive. Even though we haven't fully built out these parts, we intended to recommend more interventions than just permanent supportive housing and rapid rehousing. We'd like it to also recommend transitional housing if that's an option that the client prefers, or market rate housing, or diversion from the system if reunification with family or friends is possible. So we were hoping to get a much more comprehensive tool that would still be a single, one tool meets all needs, a big monster tool that everyone gets evaluated for, so that everyone is evaluated for the same set of options. And again, that it would be dynamic, that if the client calls and says, I feel unsafe in my home, they're immediately diverted to speak with domestic violence specialist, and can finish the tool another day. So the experience of the tool is different based on the client's presenting needs. And another thing we felt strongly is that we didn't want to duplicate questions that would be asked in other required assessments. So some components of the VI-SPDAT are very similar to questions that HUD requires you to ask for HMIS, and we didn't want to ask the same question in 3 different ways. We wanted to ask the question once so that the client would not be overly burdened with answering so many questions. So where possible, we defaulted to the HUD versions of those questions, especially where it came down to eligibility and the homeless definition. So we asked homeless history in a way that aligns with the HUD definition of chronic homelessness. And some of the other questions we hewed more closely to the HMIS recommendations of how to ask those questions. The next slide, so I talked about that. The other thing that our outreach workers had experienced in the field, and this came from several years of actually using the vulnerability index, that they didn't want a separate tool for single adults and families, because very frequently a household will be a single adult on Monday, have legal custody of children on Tuesday, and then the legal status is dubious by Friday. They wanted to have one tool that you do, and you could get a score that would score that household for a single adult or a family, and you would have two valid scores that you could easily flip between, instead of having to re-administer the tool again or having them to begin the whole assessment again. So we, to that end, we merged the family and single adult into one tool with an appendix for all the family questions, and some language around when to add to certain questions, have you or a member of your household experienced this? So that was something that we were glad was possible, but took a little finagling to make it happen. We also, through our experience of having used the VI for a couple years, we had some advocacy groups, especially youth and battered women advocacy groups, that felt very invested in locally derived factors that we had used to predict vulnerability in those, and families as well, in those populations, which had actually proved in emerging research to be found that other cities, the transition age youth tool in LA and the CSH study on vulnerability in families closely aligned with factors that we had locally developed with our partners to predict not medical vulnerability, but families and youth who are most likely to need permanent supportive housing to get out of homelessness. And these advocates felt strongly that we continue to include those factors so that families and youth aren't continuing to cycle through homelessness, and that there's some method for prioritizing them, ending their homelessness as well. Aside from that, a lot of the initial pushback that we got from advocates about the VI-SPDAT itself was really they didn't like a word or two here and there. So our process of putting each VI-SPDAT question into a Google spreadsheet and asking them to tell us what they like, didn't like, we just had several columns about each question, really helped us understand, oh, they just didn't like, 5 people didn't like question 32 or something like that. That's something we can work with without abandoning this great tool that brings us so much progress and doesn't set us back to square one into drafting a tool from scratch. So really small changes to the language ended up getting us a lot of buy-in from our work group. And then a final thing that people felt was very important is putting thought into the script. What we would say to people who didn't qualify for permanent supportive housing. Are we going to offer them a list of shelters since we haven't coordinated shelter placements yet? What can we say to families who want to know, will this prompt a CPS case if I tell you, yes, my children spend time of more than 4 hours unsupervised a day? What are we legally obligated to tell them? So putting a lot of thought into the assessor script was also very important to us locally. And then lastly, the scoring. That's something we don't have a lot of time or resources to do a study, so we wanted to hew as closely as possible to the VI-SPDAT scoring methodology that was already tested and much more rigorously based in the research. Because we didn't have our own resources to validate and test a different tool. So we felt strongly that we need to just not move too far away from the scoring methodology that was already in place. And so only very small things are adjusted, and the scoring system is very, very similar. And we are looking into a possible partnership with the Johns Hopkins Bloomberg School of Public Health to test our tool, but just so not to make the perfect the enemy of the good, we're just ready to get rolling with this tool as it is without testing it and validating it. We feel like it has a lot of community support. It's very close to a tool that is tested and validated. So I think it behooves us to, and will benefit everybody in the community to get out there and start using it and fixing it as we